What does informed consent for ECT or electroconvulsive therapy look like? My name is Dr. Ruth Dutton. I'm a board certified adult psychiatrist and I've been going through a series where each day I talk about one of our most commonly prescribed psychiatric medications and I go through the informed consent process as I would with one of my patients. However, one of the things that's come up multiple times in the comments is, what about ECT? So ECT is not a medication, obviously. We call it a neuromodulatory treatment, which means that it's an intervention that we are applying directly to the brain to modulate the brain and its functioning to address mental health symptoms. So ECT has been around since the 1930s, so a long time, and we have a lot of evidence to show that it is effective. So what is it exactly? Basically, a mild electrical current is applied to the brain while the individual is under general anesthesia, and this induces a brief seizure. And while we don't understand exactly what happens here, we do know that it likely increases neuroplasticity and causes other changes in the brain that help to regulate mood and emotion. The whole process takes about an hour, probably, if you're going through an outpatient system where, you have to go in, they put you under general anesthesia, they induce the seizure. That process takes about 3 minutes. But then, of course, you have to get wheeled out to recovery, wake up. So the whole process takes about an hour. And a typical ECT course is going to start at about 3 sessions a week for 3 to 5 weeks. So it certainly is a time commitment. What is it used for? So it's FDA approved for severe depression, either major depressive disorder or bipolar depression, as well as catatonia. If you have questions about catatonia, put those in the comments, but we can get into that in another video. Common side effects include things like temporary confusion, headache, muscle aches, and nausea. There can also be usually short-term memory loss, so people may have difficulty making new memories around the time of the ECT treatment, but in most cases, this resolves over time. And then additionally, there's going to be the risks of any procedure requiring anesthesia, as far as respiratory depression, someone having an allergic reaction, etc. Now, I will say that because this procedure is so short, there's no intubation or anything like that. Usually it's a milder level of sedation and the breathing is just assisted with a bag mask. So this all sounds like a lot, right? It's kind of a scary concept. There are some concerning side effects and it's also a big time commitment. So why would someone want to do this? Well, the evidence shows that it's really pretty effective. So if you're someone who has tried everything else and nothing is working, then it may be worth considering. In addition to being effective in some patients who have not had benefit from medication, it also provides rapid relief. So usually people are noticing improvement within 3 to 6 sessions, so a couple of weeks. And of course, this may be the best option for some patients who aren't able to tolerate medications for whatever reason. On the other hand, there are people who are not able to tolerate ECT due to basically the risks of anesthesia. So it does require getting medical clearance from a medical provider. If someone has cardiac issues or pulmonary issues that would preclude them from being able to undergo anesthesia, then this wouldn't be an option for them. If you've had an experience with ECT and you want to share it in the comments below, then please do so. Additionally, if there's another procedure or medication that you want to hear me go through the informed consent process for related to psychiatry, then put that in the comments below as well. I'm also putting together an email list for those of you who are interested in my content because I may be having future offerings, courses, resources that I want to be able to share with you all. And having a list like this enables me to do that directly. So if that's you, send me a DM with your email and I'll see you in the next one.